What is drug distribution? What is drug distribution? It is the movement or the transferring of drugs molecule from systemic circulation to different target tissues. Best definition दे दा. Drug distribution is, this is the movement of drugs from systemic circulation. Systemic circulation means blood plasma. Blood plasma to different target tissues, right? For example, if we have taken a drug orally, and for example 95% of drug is absorbed into systemic circulation. This is, for example, systemic circulation, and from here the drug is distributed into different body tissues. This process is called distribution of drug. For example, this drug taken, the drug from extracellular fluids, and from here the drug will go to target tissues. This is called distribution of drug. But remember one thing here, that when we take a drug and just in the seconds elimination started, eliminations of drug is started, and this distribution is also dependent upon that elimination. If the drug is eliminating in more amount, the proteins present here in plasma like albumin, it will debound the drug from itself, and the concentration of unchanged or unbound drug in plasma will be increases. And when the unbound drug or free form of drug is increases in plasma, the distribution will be increases, right? So this is called the distribution of drug. When we take a drug, for example, if we take a drug IV in intravenous route, distribution step, absorption step is skipped, right? For example, if I am injecting this drug directly into blood, the absorption step is skipped here. It will start distribution directly. Why? Because in IV route the drug bypass the GI tract or first pass metabolism, portal circulation, etc. So this drug will start distribution directly, and this is the reason why IV route is used as an emergency route, because it will start effect immediately. So this is called distribution of drug. Now, what are the factors which can inhibit or which can increase or decrease drugs distribution? Because drug distribution is very important for drugs effect. If the drug is not distributing in body, it cannot show the maximum or minimal effect, right? So the factors affecting drugs distribution. What are the factors? First factor is blood flow to organs. Second is lipophilicity. Third is plasma protein binding. Fourth is tissues protein binding. Fifth is the distribution of drug into body compartments. These are the factors which can affect the drug distribution. Now we will discuss one by one: blood flow, lipophilicity, etc. For example, the first one is blood beauty. बिल्कुल इफेक्टिव अगर बघितलं सवय मागे तर मग स्ट्रोक या शॉक कंडिशन होयो और स्ट्रोक या शॉक कंडिशन तर पेशेंट जी तर डिस्ट्रीब्यूशन में कमी और डिस्ट्रीब्यूशन कमी की दे खामखा दबाने वाला ड्रग इफेक्ट कमी ठीक दा हाँ फर्स्ट फैक्टर इज ब्लड फ्लो blood flow. What are the tissues which takes more blood flow, are high vascular? First is brain, for example brain. Second is kidney, and third is liver. These are the organs which have high vascular system in body. For example, if I have taken a drug orally, and this is the blood circulation. But remember anatomical point here that the cells in capillaries having some junctions. Right? If the drug is present here and this drug is small, it have no charge, or it is lipophilic, the drug will easily absorbed into body in blood and will easily cross these membranes to go into the organs, right? One of the important thing here we have forgotten, that capillaries permeability. Drug distribution is highly dependent upon capillaries permeability, because in our body the capillary structure is different in some parts, for example in brain, in liver and kidneys, right? So here the organs which gets more blood will take more drug. For example, if the blood flow is right, absorption will be high and drug distribution will be, it means that the drug will be concentrated in plasma as well as in tissues, right? But here the drug must be small, this drug must be, it must be small, it must having low charge, and it must have lipophilic. So the drug distribution will be, drugs distribution will be high, right? Now the organs which are getting low blood or less blood, for example adipose tissues. First is, this is adipose tissues are skin, etc. If the blood flow is decreasing, absorption will be decreasing, so distribution of drug will be decreasing, right? But here if the patient is caused by shock or stroke, if the patient having shock like septic shock or having hypovolemic shock, cardiogenic shock, neuroleptic shock. Shock have how many types? At least it have approximately 5 types. Hypovolemic shock, if you have low blood fluids, body fluids. Cardiogenic shock, if you have a shock due to cardiac reasons. For example, you have neuroleptic shock, this is due to neuro problems. For example, you have septic Septic shock. Septic shock is due to bacterial or other microbial infections. And last one is anaphylactic shock. Anaphylactic shock is due to allergic reactions, right? So if the patient is in shock condition, like for example, if a patient have hypovolemic shock or cardiogenic shock, and the patient have low cardiac output, if the cardiac output is low, what is the normal value of cardiac output? Normal cardiac output is equal to 5 liters per minute, right? If the cardiac output is decreasing, it means the blood flow is decreasing. When the blood flow is decreasing, the absorption is decreasing, so distribution of drug will be decreasing, right? But in septic shock it will be different in septic shock, because in septic shock the blood flow is decreasing, but the capillary permeability will be increasing. We will discuss just in a few seconds. Now if the patient having tachycardic, if the patient is tachycardic, ventricular VT, ventricular tachycardia, or arterial fibrillation, the heart is only vibrating, right? So the heart is not able to transfer enough blood to body. It will also affect the drug distribution in body. So these are the conditions which can affect drug distribution. The next is capillaries permeability. Concentrated. For example, if this is your blood capillary, right, and the drug is present in systemic circulation, and these are your body tissues. Distribution means the transferring of this drug from here to here. If the volume of distribution of drug is decreasing, there is no distribution, it means the drug is concentrating in plasma. Second is capillary permeability. Capillaries permeability. Second is capillaries permeability. What is permeability? The ability of cell membrane to pass the things from itself, right, from one compartment to other compartment. This is called permeability. We have high blood supply in brain and liver, but there is a lot of anatomical difference between the capillaries of brain and liver. I am taking one of the cross-sectional capillary from liver and one is from brain, right? For example, this is from liver. This is from liver. If this is the basement membrane of capillary, this is the basement membrane of capillaries, and these are the cells of capillaries which are in liver. Here we have a very dominant spaces between the epithelium of these capillaries. Do you remember this? For example, if I have a liver here, this is a liver, and these are the capillaries of liver. It have a lot of spaces, and when the nutrients, the drugs, etc. Moves to liver, it will easily leave these capillaries to hepatocyte, because in hepatocyte metabolism occurs, and for metabolism this drug is available, right? So if this capillary is called sinusoidal capillaries, or it is called penetrated capillaries. These capillaries are called sinusoidal capillary. It is also known as penetrated capillaries because it have a lot of spaces. And for example, these are the hepatocytes. These are the hepatocytes around the capillary. We are taking the cross section of capillary. For example, this is the capillary of liver, and I want to cut this capillary here and see it from here. It is like this, a lot of spaces it have, and that's why it is called sinusoidal capillaries. For example, this is the drug present in this capillary. So the permeability of this capillary is high permeability, right? This drug will easily leave the capillary and goes into body tissues. So the permeability is high, so the distribution of drug will be high, right? So this is the direct relation between capillary permeability and drug distribution, right? For example, I have brain cells, brain capillaries, brain cells, no, brain capillaries, right? And this is the basement membrane of capillary, and these are the cells of epithelium. There are no spaces between these capillaries, so it's mean that the capillary permeability is very low. These are the tight junctions of capillaries of brain, right? And we also have osteocyte cells here. What are osteocytes? Anyone? Osteocytes, astrocytes, osteocytes. Osteocytes, not osteocytes, astrocytes. Astrocytes. Neurons? These are glial cells, the supporting cells of neurons. And this green is blood-brain barrier, for example. So if we have a drug here, and this drug cannot leave this capillary easily. There are some conditions for this drug. For example, this is highly lipophilic. If the drug is highly lipophilic, it will leave the membrane easily. For example, we are taking propofol. Do you know propofol? This is a general anesthetic drug. General anesthetic. For example, propofol. Propofol. This is general anesthetic drug. This drug is highly lipid soluble. The molecular weight of this drug is very low, right? So it can easily pass from the capillaries of brain, and for an instant it causes general anesthesia. The distribution of this drug in brain is very high. For example, brain have 60%, it means that brain have 60% fats, plasmalinogen fats, etc. For example, from here the propofol drug is distributing very slowly into adipose tissues and other tissues, and slowly when the drug is cleared from CNS, the patient is recovered from anesthesia. This is the second point of factors affecting drug distribution, which is capillary permeability. If we have increased capillary permeability, we have increased volume of distribution, and if we have low capillary permeability, we have low distribution. This is so simple, right? The next is plasma protein binding. Third is plasma, or simply you can say that protein binding. And protein binding have two types. If the drug may be attached to the proteins of plasma, and it can be attached to the proteins of tissues, right? So plasma protein binding. The dominant protein in plasma is albumin, and albumin is synthesizing by liver. Liver is responsible for synthesizing albumin. So for example, this is liver, and we have, this is blood supply, and one other organ which play a very important role in the maintenance of albumin in plasma is kidney, right? So this liver is responsible for making albumins, and for example these are albumins. Can albumin can cross this membrane? Why? Even it is, even it have a lipid solubility, but it cannot cross this membrane. Why? Because it have a very high molecular weight. Albumins are called the larger protein of plasma, right? So for example these are albumins, and this albumin level is maintained in blood by kidneys, right? First, for example, if we are taking a drug, this is a drug absorbed to blood, and it have a very high plasma protein, very high plasma protein binding. For example, these are body tissues, right? And only a few milligrams or few amount of, very less amount of drug is in free form. The volume of distribution will be, distribution of drug will be low. For example, if we have high plasma protein binding, right, we have low distribution. We will discuss two conditions here. For example, if a patient have fatty liver, do you know fatty liver? It is called fatty liver. Second is cirrhosis, hepatitis. For example, we have fatty liver, cirrhosis, hepatitis, or liver failure, right? In this condition, the liver is not functioning properly. It means that the liver is not able to produce enough albumin. So the albumin level will be, albumin in liver conditions, albumin synthesizing will be low. So the plasma protein binding will be low, right? And due to this, the free drug in plasma will be high, and distribution will be high. The second, if a patient have kidney problem, for example chronic kidney disease, it's called CKD, chronic kidney disease. This kidney is not able to maintain the albumin level in blood. Why? Because it will pass albumin into urine, and if urine have albumin level, it is called proteinuria, and this is one of the best examination for kidney function. That if your urine have any type of protein like albumin, it means that your kidney is not functioning properly. These are very large proteins, albumin, and the glomerulus is not able to pass this protein into urine. So if you have chronic kidney disease or anything else about kidney, your kidney is not able to maintain the albumin level in plasma, right? So albumin level will be decreases, plasma protein binding will be decreases, free drug amount will be increases, and distribution will be increases. The second condition, if this plasma protein binding, which drug is very high favorable for this plasma protein binding? Warfarin. Warfarin. Warfarin is anticoagulant. This is PRF. Warfarin. Warfarin is anticoagulant drug, and it has very high plasma protein binding. So the warfarin drug will be concentrates in plasma, and we need this warfarin in plasma because it have antiplatelets activities, and it inhibit the blood clotting, right? So this drug, this warfarin drug, follows this pathway, that it have very high plasma protein binding and it have low distribution. It have low distribution to drug. Now if we take warfarin with omeprazole, we are taking warfarin with omeprazole. Omeprazole is proton pump inhibitor, right? Omeprazole will inhibit the enzyme which is responsible for the activity of warfarin, and it will increase the plasma protein binding from normal. And if we are taking omeprazole with warfarin, we have a lot of chances of internal bleeding. Omeprazole is contraindicated in the patient who are using warfarin, and warfarin is contraindicated in the patient who are using omeprazole, right? The next is, for example, if the drug have low, this is high plasma protein binding, if the drug have low plasma protein binding, it means the concentration of free drug is high in plasma, and it means that distribution of drug is high, right? This pathway is followed by chloroquine. Chloroquine is one of the anti-malarial drug, very broadly used drug. Chloroquine, anti-malarial drug. For example, I have, this is a blood vessel and these are the albumin protein, and this chloroquine have very low plasma protein binding. It means that it is in very high amount in free form in plasma. The free form of chloroquine is high. It means that it has a high volume of drugs distribution, and we also need this drug in plasma, not in tissues, right? Why? Because the plasmodium is attacking on RBCs. We need this chloroquine in RBC to kill the plasmodium, and this drug have very high distribution and going to very rapidly to body tissues. And this is one of the unfortunate point here, that we are taking, due to this reason we are taking the chloroquine in very high doses. So chloroquine have very low plasma protein binding property, so it has very high amount of free form in plasma, so the drug distribution is very high, and this is toxic point of chloroquine, right? The next point is lipophilicity. If the drug is very highly lipid soluble, lipophilicity, or we can simply say solubility of drug. For example, we have two drugs, right, and these are the body tissues, for example, and this drug is hydrophobic, mean this is very high lipid soluble, so it can cross these membranes very easily, and the volume of the distribution of drug is very high. When the lipophilicity is increasing, the distribution of drug will be increasing, right? And if we have a drug here, and this drug is hydrophilic, it cannot cross through these all membranes, and the distribution of drug will be low. This is the lipophilicity effect on drug distribution. Huh? Hmm? Selectively permeable, thus if you go the brain capillaries are only permeable to those drugs which have very special transporters. Very special transporters are responsible to take this drug from here up to brain cells. For example, if you are taking levodopa, levodopa levodopa cannot cross this membrane easily, so it has a very special transporter which are called levodopa transporters. Levodopa transporters are responsible for taking this blood from capillaries into brain cells. Volume of distribution, the next factor. Volume of distribution. What is volume of distribution? Volume of distribution is represented by Vd. Vd, volume of distribution. What is this volume of distribution? We cannot find volume of distribution accurately, but this is the apparent volume of fluids required to maintain or distribute the drugs at the same concentration to the plasma. For example, we have three compartments in body. Three compartments. One is plasma, second is interstitial fluids, third is intracellular fluids, water. This plasma concentration is approximately, according to your Lippincott book, it is 4 liters. 4 liters. This interstitial fluids are 14 liters, and this intracellular fluids are it occupies 60% of total body weight, 42 liters, right? So if we, for example, if a patient taking a blood, for example, this is one compartment, this is other compartment, and this is the some of the drugs will remain in plasma, so the volume of distribution of those drugs is very low because plasma concentration is low, 4 liters. If the drug have affinity to travel or move to interstitial fluids, it is somewhat in medium, it is in between 42 and 4, which is 14 liters. And if the drug can travel to intracellular fluids, it means that it have a very high volume of distribution, right? So for example, this is plasma, this is plasma compartment, this is interstitial fluids, and these are intracellular fluids. If we have three drugs, for example, one is this one is this, and one is this one. This drug have, for example, very high plasma protein binding, very high plasma protein binding. It means that this drug is have very low amount in free form, right? So the first property is high plasma protein binding. Second is it is hydro hydrophilic. For example, it have high molecular weight. It means that this drug cannot readily pass into interstitial fluids and intracellular fluids. It means that this drug have very low volume of distribution, which is approximately 4 liter, because this drug is only remaining in plasma and plasma concentration is 4 liters. For example, this is another drug. This is next drug, and this drug is, for example, it have high or somewhat medium plasma protein binding. It is hydrophilic, but this drug have low molecular weight. It means that this drug is small, right? And we know that this capillary have gaps in their epithelium, right? This drug can move to interstitial fluids, but this drug cannot cross these membranes, intracellular membranes. So it means that this drug have volume of distribution in intracellular fluids and plasma, and the volume of distribution is medium, which is approximately 4 liters plus 14 liters, which is 18 liters, right? This is the next drug. For example, this drug is having low plasma protein binding, and it have lipophilicity, mean lipophilic, and small in size. The volume of distribution, for example, it can easily pass to intracellular interstitial fluids, and from here it can easily distribute into intracellular fluids. It means that it have plasma concentration, also it have intracellular fluids concentration, and also it have intracellular fluids concentration interstitial. So the volume of distribution is approximately 4 liter plus 14 liters plus 42. It is 60 somewhat 60 liters. This is called total body water, because we have 60 to 65% of water in our body. If the drug is lipophilic and it can cross the membranes, it have affinity for all the compartments of body and have very high volume of distribution. What will be the effect of volume of distribution on half life? Saima, what will be the effect of volume of distribution on half life? half life पे सेवाई good. Chikala gora volume of distribution is inversely proportional to half life. If half life volume of distribution is increasing, half life is decreasing. Because what is half life? This is the time required to reduce the drug by half or eliminate the drug by half from body. This is called half. For example, if we have 100 mg of drug in first half life, it become 50 mg. In second half life, 25, and third half life, 12.5. Right? These are called half lives, because the body is reduced the drug by half. So if volume of distribution is increasing, half life is decreasing, and if the volume of distribution is decreasing, the half life is increasing. What will be the effect on the effect of drug in target tissues and volume of distribution? If the volume of distribution is low, the drug moving to target tissues in very less amount, and the drug effect will be low. For example, we have taken the example of chloroquine. The target cell of chloroquine is RBC, and the volume of distribution of chloroquine is very high, so it has no effect on target tissues enough which is required.